dates. But on Power and Politics last night, we heard from the New Brunswick Premier Blaine Higgs. And again, it's not as tense as you might think it is, because Blaine Higgs is explaining, yes, the federal government is working as hard as it can to get those doses out there. However, it's also up to the pharmaceuticals as to how much dosing comes. And so they're understanding that, yes, there is this whole back and forth between the pharmaceuticals as well. So they understand, however, there's this political pressure as well from Canadians seeing these record high numbers, more cases in all the provinces, and they want to find a solution. And some bad news, of course, from Premier Ford today. He's saying that you have to hold on, and you have to hold on until April, May, or June. And people are probably sitting at home thinking, still until that date, they have to hold on to get those doses into arms, and a substantial amount as well.
Sure. Although the federal government's plan had always been sort of the general population vaccinations were to take place starting somewhere in April. And then the Prime Minister again saying yesterday he expects everyone to be done in September. So you can understand that the provinces want to ramp up. At the same time, you can't vaccinate if you don't have them.
Exactly.
And that's the production and manufacturing and distribution will also ramp up. I'll bring in Catherine Cullen. I think we have her with us now. There are more than 548,000 doses of vaccine have been delivered to Canada, according to various sort of trackers that are out there, COVID vaccine trackers that are out there. About 43% of those have been administered. So there is a political story going on here too, Catherine, about, as Hannah rightly points out, provinces that are in deep trouble in terms of the number of cases they have, wanting to be doing something to vaccinate the population, wanting to be looking like they're doing something too.
Well, I mean, in some ways, Rosemary, of course, we hope, and in some ways it is very true that this is an apolitical issue, right? We want the question of vaccines to be very much grounded in science, and when it comes to the Health Canada approval process, certainly we are constantly reassured by officials on all levels that it is. At the same time, we have to acknowledge that there is, in some ways, a no more political issue in the country right now, whether you're the federal government or the provincial government, particularly in light of that sobering message that we heard from Doug Ford today, really pleading with people, saying you're going to fall off your chairs when you see the modeling numbers, and it doesn't matter, he says, how good our hospital network is. If individual people are not stepping up, we cannot control this situation. So you have that dire situation. You have people looking to vaccines for hope, a finite quantity of vaccines. Certainly there is a lot of political push and pull. I think it's noteworthy that in the last few hours, the tone has been more conciliatory. I mean, I think what we heard from Premier Ford vis-a-vis the government, on the one hand, essentially saying, like, listen, we need more supply, but that he appreciated, I believe the term he used was that the Prime Minister is working his back off, was the term that Doug Ford used. Blaine Higgs, speaking to our colleague Vashi Kapelos yesterday, saying ultimately the tone on that call with the First Ministers, it was amicable, but there's a request for more. There is a finite amount. So this question of ramping it up, yes, it's a very political one for everyone involved. They all want to be seen doing their utmost. It is something that everyone, I think, has to manage incredibly carefully, and it's perhaps not surprising, particularly in Canada. We've said it so many times, it's trite now that this pandemic is unprecedented, but a federal-provincial push-pull over who's doing their part, that's a bit of an old story. It's not surprising it's emerging here again.
Yeah, and it has been sort of the story of the pandemic, whether it be around testing, contact tracing, getting PPE. We've seen it time and again, and of course the pressure now more intense because we are trying to get to a finish line here with the vaccination. Also at a time, as we've all pointed out, where things are pretty dire in many provinces. I also thought that the Ontario Premier today was. His language was pretty stark, suggesting that modeling numbers next week would show the situation's getting out of control. A couple other things we might expect to hear from the Prime Minister today, and that is something around the ongoing situation in the United States. Donald Trump tweeting just not too long ago that he does not plan to attend the inauguration to be held in about a week and a half or so. We have heard the Prime Minister on some private radios shows, Hannah, and certainly in tweets around the situation as it was unfolding at the Capitol building, but we haven't heard him publicly speak to this yet.
Yeah, this will probably be the first time we hear that. We've heard him, as you mentioned, on radio stations, on tweets, and in fact, we even saw American networks quoting what the Prime Minister had to say, saying he and Canadians were disappointed in what they saw happen on the Capitol 2 days ago when mass mobs stormed it. So it will be interesting to see what he thinks of this and if he will use stronger language. In fact, today, some world leaders have been stronger in their language towards the current president. As you mentioned, the current president not attending the inauguration in a couple of weeks. That is, I think, the first time ever something like that has happened. Not unsurprising, though, really, with this president. One of the things that, I want to kind of tie this back to Canada, that the premiers were trying to show last night with the Prime Minister, is that it doesn't matter what political stripe you are, that they can work together on very complicated issues. And I think that's why the tone last night kind of went down and maybe ratcheted down a little bit, as we had heard earlier in the week, showing that they can work together on issues like this, and a much different tone and situation than we are seeing in the United States.
Yeah, I think that's probably a good point, because that was part of the readout from the Prime Minister last night too, Catherine, that this was that they spoke about the situation and talked about the collaborative approach that they've taken in light of the way things have unfolded in the United States. I think it's the first time in modern history, because there are some very old examples of presidents not attending. Yeah, but the first time in modern history. Catherine, what might you expect to hear from the Prime Minister on that front?
Yes, well, I mean, again, in a way, it will be a return, I think, to things we have seen before. It's so dangerous to predict anything in this day and age, Rosemary, but I will say on this particular one, we have seen time and time again that reporters have tried to prompt, push, pull Justin Trudeau into weighing in on what's happening in the United States. It is, of course, a particularly unique situation right now, given that we are literally counting the days until Donald Trump leaves office and a new President-elect Joe Biden takes his place. I would nonetheless be surprised if the Prime Minister were to weigh into that particular political fray. Now, the NDP has tried to make the point that there are issues here that are germane to Canada, that when it comes to white supremacist groups, when it comes to extremist groups, that those are issues of concern in Canada. It is certainly something that Canada's security and intelligence services have noted. Notably, Jagmeet Singh has said that the Proud Boys in particular, founder Gavin McInnes, a Canadian, should be listed as a terrorist entity. So perhaps the Prime Minister will be prompted for his thoughts on that. But when it comes to weighing in on the political situation, the specifics of the political situation of what's happening in the United States, I think we would expect the Prime Minister once again to express ultimate faith in U.S. institutions to get through this, although perhaps as well some dismay about those, incredibly troubling scenes. I mean, it's hard to find the words to describe just what happened in the Capitol earlier this week.
Yeah, I mean, I guess I think you're probably right. I guess the question would be, as Hannah was suggesting, if you've got only 10 days left with the president, is there a risk in going further down the road or being more critical than you have in the past in light of the fact that the president is being blamed for inciting those mobsters, protesters, rioters, whatever you want to call them, to go in and take control of the building. But certainly past behavior has shown us that the Prime Minister doesn't tend to go down that road, knowing that the potential damage it could cause, even in these last days of the Trump administration. His
most notable remark, I think, thus far on President Trump in many ways was that 21 seconds of silence,
That's
right? So, I mean, you're very right to point out that we are coming to the end of this administration, and who knows what's going to happen. I guess the question becomes what the political upside is for the Prime Minister, because I think both himself and his aides, a lot of thought goes into how he responds when it comes to this particular relationship.
So we are standing by waiting for the Prime Minister to come out and speak to us today after, of course, as we've mentioned, that First Minister's call last night. I believe it was the 24th or 25th call so far between the federal government and the premiers. The conversation very much shifting now to a couple of things, the focus of the vaccine distribution, administration, and whether Ottawa can get its hands on more vaccine more quickly, but also conversations around whether there are things that Ottawa can do to help, particularly in the provinces where, although it seems like this is sort of the case across the country, where things are very, very bad. Quebec, of course, putting in place a curfew that starts tomorrow. Ontario now considering further measures. Ontario also not allowing kids back to school, elementary kids back to school on Monday, as had been planned. That has now been delayed. And I believe, Hannah, and correct me if I'm wrong, there was also some conversation around long-term care as it relates to Ontario, because that is also fairly dire in this province yet again.
Yeah, and we heard a story from the Globe and Mail this morning. They went into one of those long-term care homes, and there was a resident who was naked. They had a very pale face and urine. Again, like, how could this be happening? These are the stories that we heard back in March. So that was a part of the discussion. And when it comes to that and to vaccines, the Prime Minister said, what type of help do you need? Is there anything that the federal government can do? When it comes to the vaccine side of it, he did remind the premiers that no province at this time is currently out of vaccines. If you look at the latest numbers, and I'm just kind of pulling up one of these trackers that goes through all of the health websites right across this country, the provincial health websites, there are now over 545,000 doses delivered to the provinces, and in fact 45% of those have been administered. Now, there are some provinces who are holding back their second dose. So they want to ensure, because they're starting to give those second doses this week, that the second dose is available for those people who did get the first dose. There are other provinces like Ontario that have now decided, as of I think it was December 21st, that they are just going to take all their doses that they receive and administer them, and then hope that there's no problem with the supply chain to get those second doses within the 2 to 3 weeks that they need to have that second dose in order to get the immunity up to the high levels that they want to get it at. So the Prime Minister said if there's anything they can do to help, is it things like we saw in the first wave with long-term care homes? Do you need the Canadian Armed Forces? Do you need something like the Red Cross? Those are examples of what could potentially happen, but at this point, there is no hands going up by the Premier saying we need that type of help.
Yeah, they have to ask for it. It can't just be the federal government sending in the military or the Red Cross, as they have done in the past. So we'll wait and see whether that official ask comes. Catherine, I think you wanted to jump in there.
I would just add the one ask that we did hear rather clearly from Doug Ford today was approval of the AstraZeneca vaccine.
Yes.
In fact, the Premier said twice we are desperately in need of it. The caveat I would say there, we certainly heard from BC, from Dr. Bonnie Henry, that her understanding was that that vaccine was not going to be available until the second quarter. So approving it, obviously an important part of the process, but the crucial part, I mean, the point has been made, vaccines don't save lives, vaccinations save lives. So when can Canada actually access that vaccine? Are there, if that is indeed the case, that we're not scheduled to get it until the second quarter, is there a possibility of getting some of it sooner? I mean, I don't think at the end of the day it's the particular vaccine that is of any concern to premiers right now, although obviously there are challenges around Pfizer and the ultra-cold temperatures, but it is just having sufficient supply of what is essentially the most valuable commodity in the world right now. And what can Canada do in order to try to ramp up that supply, with the understanding, as all the premiers seem to have, and certainly the message from the federal government, that there is certainly going to be some waiting involved, and how much waiting too, certainly a subject of debate as well. There are stories out of Manitoba and Alberta suggesting that contrary to what the federal government has said, a majority of Canadians, or all Canadians who want it, won't necessarily be vaccinated this year. But we know with the Manitoba story in particular, that is based on information about the currently approved vaccines, whereas the federal government's information, it seems, is based on the idea that all 7 vaccines in the portfolio are going to be approved. So where exactly does the truth lie when it comes to what it means to individual Canadians who are waiting to be vaccinated? There are so many competing factors in all of this, including the timeline of receiving these vaccines and those approvals. It becomes incredibly complex.
Yeah, and again, go ahead, Hannah. Sorry.
Yeah, just to pick up on that AstraZeneca part, I think Catherine's absolutely right. Yes, we heard Ford saying, get Health Canada to approve this, and usually politicians don't do that, but I think it's signs of desperation in the province right now. But for that AstraZeneca, I think, and this is one of the questions we're going to ask officials today, is that the contract for AstraZeneca wouldn't start until, and as you know, Catherine was saying, until later into, I'm not sure what month. We'll find out what month that is. So even if it was approved, we may not have the contract to actually get those doses as of yet.
Yeah, I mean, I think, again, people, as they see the vaccinations start to roll out, there's a certain amount of, as you rightly both point out, desperation, right, to try and get the maximum number of people vaccinated. But again, it was never in, at least the federal government's timeline, to start mass vaccination until the spring. So, you know, the provinces also need to figure out, are they using all their vaccine? Are they getting it to the places where they need to get it for now? The AstraZeneca thing, you're quite right. There's a public briefing right after the Prime Minister public health briefing. So we'll hear more about vaccination updates in terms of perhaps where that approval process is. Health Canada has been doing rolling approvals for vaccines, which means that it can happen very, very quickly once they've got all the information from the pharmaceutical company.
Yeah, and they can actually, with that rolling approval too, if the company allows, pre-position the vaccines in Canada so they can go just like that once it's approved.
Right.
We know as of before the break, I was just going to say, Dr. New said, I believe on December 30th, that they were certainly still lacking in data, in information from the manufacturer. So there was still information they were looking for, but in you know, in the timeline of this outbreak, I mean, 10 days is an incredible amount of time. I would just add too to what you were saying earlier, Rosemary, that every vaccination, when it is successful, it is a success story. And we look at how grim the picture is across the country right now, and how I think hungry we are as individuals for some hope and some success, but certainly politically as well, when there are these very hard questions that so many premiers are facing about how did it get this bad again? I mean, again, going back to Premier Ford, but it's important to talk about Quebec too, where this curfew is being put in place. Like these are incredibly desperate times, and the Premier is saying today, you know, this is as bad as it's been, and the information that they're going to be bringing us on modeling is going to be very disturbing. So the idea of being able to reach for some sort of success and hope, I think we can all appreciate why there would be a focus on that.
Yeah, and I should point out that the approval process for drugs obviously is different in each country. I would note that the United Kingdom today, only just today, approved the Moderna vaccine, whereas it had first approved the AstraZeneca, which was developed in the United Kingdom. So it's happening in different timelines in different places. But the one thing we have seen too is that Ottawa has managed to speed up the acquisition of those vaccines. So even if the approval process, you know, takes a little while, we weren't expecting to get all the vaccines that we got before the end of the year, and we did get them. So that also, some people questioning whether that too was a factor in the slow sort of slow uptick of inoculation at the beginning, because provinces perhaps weren't quite as prepared for it as we might have expected, given that they weren't expecting the vaccines to arrive until like about now, really. So so things actually have clipped along at a fairly maybe a normal pace. If you look at those websites too that we're all talking about, the aggregator websites of vaccines that have been done by various public health professionals, you can actually start to see that the pace of vaccination is moving up, but it's moving up slowly. We did get the 2-minute mark. Oh, there we go. There he is. As I run out of things to say, he appears. Okay. Thank you, ladies. We'll come back to you both in a moment. Here is the Prime Minister of Canada.
Hello, everyone. Bon vendredi, tout le monde. I'd like to begin by addressing what unfolded in Washington, D.C. this week. What we witnessed was an assault on democracy by violent rioters, incited by the current president and other politicians. As shocking, deeply disturbing, and frankly saddening as that event remains, we've also seen this week that democracy is resilient in America, our closest ally and neighbor. Violence has no place in our societies, and extremists will not succeed in overruling the will of the people. As Canadians, I think we've been all reflecting on our own country, something I spoke with the premiers about last night, about the fact that democracy is not automatic. It takes work every day, about what a real accomplishment it is to maintain a political system in which the losing side gracefully concedes and in which rival political parties between elections work together for the common good. We have this in Canada because Canadians make it possible. Canadians expect their political leaders to protect our precious democracy by how we conduct ourselves. We have seen this manifest in unanimous consent in our Parliament for our main COVID-fighting measures at a time when the government holds a minority of seats. We see it in the cooperation between the federal government and provincial and territorial governments, regardless of political stripe. Canadians expect debate. Debate in service of all Canadians. Debate that is grounded in a shared acceptance of the facts. In a diverse country, there will always be diverse perspectives, and it is through respect for those differences that we create a stronger Canada. Canadian democracy didn't happen by accident, and it won't continue without work. We must always work to secure our democracy and not give comfort to those who promote things that are not true or give space for hatred or extremism.
Yesterday, during our 24th meeting of the ministers of the provinces and territories, we talked about what happened in the U.S. this week. We were all shocked to see extremists incited by the president to act with such violence in the capital of Washington. It reminded us that we cannot take our democracy for granted. Canada's democracy didn't happen by chance, and it will take effort to continue. Canadians expect honest debate that serve all Canadians. Debates, we all have to have a shared acceptance of facts. We all have to protect our democracy and promote democracy and avoid the space that is allowed for hatred and extremism. We also discussed long-term care homes with premiers, measures for travelers, testing and vaccines. Our government is working on vaccines tirelessly. We have been doing so for months. The distribution process has involved doses, particularly for Pfizer's vaccine, is a complex challenge. But thanks to everyone's efforts, we started distributing doses earlier than expected as of December 21st. We're doing everything we can to obtain as much vaccines as possible and as quickly as possible. Major General Fortin will provide detailed figures today. In December, we distributed roughly 500,000 of doses of this vaccine across the country, and to more than a large number of doses in Quebec. In January, there'll be 1.4 million doses of Pfizer's and Moderna's vaccines that will be distributed in Quebec. And we're trying to do so as quickly as possible. People are dying, hospitals are overflowing, and we don't want to see this. This is a crisis, and Canadians want results. I understand, and I promise that we will work tirelessly. We're continuing to cooperate with all levels of government. We have a large team. More than ever, it's the time to gather our forces to fight COVID-19 once and for all.
Yesterday, at our 24th First Ministers meeting, the Premiers and I discussed the vaccine rollout across the country. We agreed that it is vital that we work together as Team Canada to get vaccines delivered, distributed, and administered as quickly and efficiently as possible. The Premiers and I also discussed ways to combat misinformation. Vaccines are safe and effective, and everyone should be doing their part by getting vaccinated once it's their turn. This week, over 124,000 doses of the Pfizer vaccine were delivered to 68 sites across the country. Over 208 Pfizer doses will be delivered weekly for the rest of January. On Moderna, by the end of next week, over 171,000 doses will be delivered to the provinces and territories. We're on track to deliver approximately 1.3 million doses of the Pfizer and Moderna vaccines by the end of January. Quantities of both the Pfizer and the Moderna vaccine will scale up in February. Remember that Canada has the most vaccines secured per capita in the world, which means that by September, we will have enough vaccines for every Canadian who wants one. Our top priority remains keeping you and your family safe. I know things are tough right now. Frankly, it's frightening to see cases rise at home and around the world day after day. But you're not in this alone. We continue to be there for you. We're continuing to send millions of pieces of PPE to protect healthcare workers and communities. We will do whatever it takes for as long as it takes. For you, for family, for your communities, we will have your backs. And on that note, I can also confirm that yesterday, the Canadian Armed Forces approved a request for support to the Fort Albany First Nation in Ontario as they deal with the COVID-19 outbreak. The Canadian Rangers will be activated on the ground until at least January 11th. By working together, we will get through this.
As many provinces have announced stricter measures to limit the spread of COVID-19, many people are concerned about what this means for their jobs and for their families. Our government is going to continue to be there for you. This morning, we learned that the Canadian economy lost 63,000 jobs in December, most of which were related to the service industry. Since the beginning of this pandemic, our government acted quickly to support our economy and to directly support Canadians. You can be assured that we're doing everything we can to help you to get through these tough times.
Measures like the wage subsidy are making a real difference for workers and businesses who need it. For a promising new company like StrongPoint in Toronto, the wage subsidy helped keep employees on the payroll when things got tough in the spring. It was a lifeline for them. The same goes for staff at the communication firm, the Humphrey Group. The wage subsidy helped them retain their hardworking employees and get ready for recovery. It's not good news for anyone if local businesses have to close shop for good because of this global crisis. In the second wave, this is not the time to take the foot off the gas. It's the time to keep doing everything we need to ensure that our economy stays resilient and that workers and families can weather this storm. Mercredi,
on Wednesday, Quebec announced a prolongation of its lockdown. It's important for you to know that the federal government is there to support the provinces as they must take difficult decisions. For Quebecers and for all Canadians, measures are in place to help you. There's the wage subsidy that is there for workers and small businesses. For those in need, we changed EI to support a larger number of people. We won't let you down. As I said earlier, vaccines are continuing to be delivered, and we have reason to be optimistic. But for the time being, we have to follow public health directives. Stay at home, avoid gatherings, and use the free COVID alert app. Those who decide to travel and do not follow public health advice must quarantine for 2 weeks when they come back to Canada. If this quarantine is not respected, there will be legal consequences which are very severe. Since yesterday, it is now obligatory for travelers to have a negative COVID-19 test before they can take a return flight to Canada. Compared to other countries, our border measures are amongst the strictest in the world.
Now, more than ever, it is crucial that you keep doing your part to protect yourself, to help our healthcare workers, and to save lives. Wear your mask, avoid gatherings, and use the COVID Alert app. The app has now been updated to work on older models of iPhones, such as the iPhone 5, 6, and 6 Plus. Almost 6 million people have downloaded the app, And of course, the more Canadians use it, the more powerful this tool becomes. So keep it up, and remember, we're all in this together. This morning, I'd like to take a moment to recognize that today marks the one-year anniversary of the Ukraine International Airlines Flight 752 tragedy. As a country, we remember all those we lost, and we mourn with their families and friends. Of the victims aboard that flight, 138 of them were on their way to Canada. To the family members and friends who had planned to pick their loved ones up at the airport, to everyone who was looking forward to seeing your beloved partner, child, or parent, I cannot imagine your pain. Know that you are in our thoughts today. This kind of unthinkable tragedy must never happen again. That's why, over the past year, our government developed the Safer Skies Initiative and worked with partners around the world to help keep civilian aircraft away from dangerous conflict zones. Today, on the first National Day of Remembrance for Victims of Air Disasters, we remember and honor all those we lost. The victims of PS 752, just like the victims of Ethiopian Airlines Flight 302, Air India Flight 182, and other air disasters, will never be forgotten. We will be there for each other through tough times. It's what Canadians do. Whether it's grieving for elders we lost in long-term care homes, whether it's mourning together for victims of international tragedies, or whether it's standing with courageous young people like Isabella Kulak, a member of Cote First Nation, Saskatchewan, who wore her ribbon skirt to school to celebrate her culture last month. Let's remember who we are, people who are there for each other. In tough times, we pull together. We look out for each other. We support each other. It's what Canadians have learned to do through generations of dealing with winter, dealing with vast spaces, being there for each other, being there for our neighbors. We need to make it through this winter now. We need to pull together while staying apart. We need to hang in there. Spring is coming. Summer is coming. It always does. This one will be better if we can pull together right. So stay safe, everyone. We'll talk to you again soon.
Thank you, Prime Minister. We'll now go to questions from media. We'll start on the phone. One question, one follow-up. Operator.
Thank you. Merci. Première question.
First question.
La Forêt, TVA Nouvelle.
TVA Nouvelle. Question. Good morning, Prime Minister. This week, we felt that the tone has gone up with the Premier in terms of the national group on long-term care homes and the fact that there was a disagreement in terms of what you announced for Quebec and what vaccines for Quebec and what Quebec did. Did you apologize to the premiers for this? Answer, I think it remains extremely important that we work together, that we watch that everyone's doing what they can to help Canadians to get through this crisis. But what Canadians want to see is there are various leaders and politicians working together to ensure that we're doing everything that is necessary to help people. That's exactly the conversation that we had yesterday evening, whether it's our concerns in terms of our seniors and the desire of many provinces to work together to share their best practices to protect seniors in long-term care homes, or whether it's ensuring that we're sharing all the information in terms of forecasts for vaccine delivery directly to Canadians. Well, we're going to continue to work together, and that's what Canadians expect of us.
One of the things that we've seen throughout this pandemic is the need for different orders of government to work together. And yes, we need to make sure everyone is doing their part, and we'll encourage each other to do the best we very much can. But at the same time, we do have a Team Canada approach that makes sure that we're all working together for Canadians, because that's what Canadians want to see. Whether it's by ensuring that all the information is flowing directly to the provinces as we get it on vaccines from the companies. We've clearly stated the predictable schedule for the month of January, and we'll have more information soon for February and March. Or whether it's how we're sharing best practices across the country on successes in long-term care, which is something that every corner of this country is dealing with. We're going to continue to work together for the benefit of Canadians.
Follow-up question. Do you recognize that there can be a delay between the delivery of the doses of the vaccine and when they get to the provinces? Answer. I think that we're ensuring a better efficacy every day. This is enormous mobilization for vaccinations that is underway. What we've started is a good thing, and it even happened a few weeks earlier than what we were expecting. There were roughly, several thousand vaccines delivered in December. That was good news. But obviously, it takes time to establish processes to deliver vaccines efficiently and safely. Well, there's always a trial period, and we continue to help provinces so they can step up the pace in an impressive way during this weekend and in coming weeks as well. Thank you. Next question.
Merci. Thank you. Next question, Ryan Talty, National Post. Line open.
Yeah, good morning, sir. I'm wondering if, in your conversation with the premiers last night, if you were able to give them sort of a timetable for how the vaccine deliveries will ramp up. You mentioned just now that they'll ramp up in February, but I think they're probably hoping for some concrete numbers so that they can plan going forward, especially with the requirement that these vaccines receive a second dose within a certain amount of time.
Yes, that's exactly the issue that we're all working together on right now. The need for predictability allows provinces to schedule deliveries, to schedule inoculations, to have that most efficient possible system. That's why we're pleased that we're able to confirm exactly what doses they'll be getting every single week in January, and we're going to be passing along information on the schedule for February and March soon. We need to get it from the companies themselves. It's not the federal government that decides that. And as soon as we get more information from the companies, we will pass that immediately along to provinces so they can plan. We need to make sure we're being as open and transparent and rapid about it so that we can get vaccinations both to the provinces and from the provinces into people's arms as quickly as possible. And on that, we're all working together.
I think it's extremely important to have as much clarity as possible in terms of the timetable for delivering vaccines. And that's why we're really happy to be able to provide the specific timetable for January and coming weeks. And as soon as we receive the information from these companies for February and March, we will immediately share it with the provinces to allow them to better plan and get organized, and most importantly, to be able to deliver the vaccine more efficiently and quickly to vulnerable people. And that is what we're working on all together.
A follow-up question, Ryan?
Yeah, sir, I just wanted to ask you, in your opening remarks today, you said that the riots at Capitol Hill on Wednesday were incited by the current president, by President Trump. He has a significant amount of support within his own party. There are congressmen and senators who support him. And of course, he's still president for 13 more days. Do you worry about damaging Canada's relationship with the U.S. by those comments?
I think it's extremely important that we be there to defend democracy and the principles that Canadians and indeed Americans and people around the world hold dear. And recognizing that words have consequences, that choices made by people in power can have direct impact not just on behaviors, but on our very institutions, is an important thing.
Next question, operator.
Merci. Prochaine question.
Next question. Melanie Marquis from La Presse. Question. Hello, Mr. Trudeau. I'd like to go back to what you said in terms of what happened at the Capitol in Washington earlier this week. You said that rioters were incited by the president. How would you define what happened? Was it a coup d'etat? Answer. I think we all saw what the president, or heard what he said. We saw the scenes that were horrifying of a violent crowd that wanted to upset democratic institutions in the United States. It reminds us all that the choices we make as politicians and the words we use, how we position ourselves, have a direct consequence, not just on the choices we make as a society, but also the very nature of our institutions. Follow-up question. Yes. Yesterday, as you know, there were extremists such as Proud Boys that were there, and Jagmeet Singh yesterday asked your government to register this group on the list of terrorist organizations. Do you think this will happen? Answer. The decisions in terms of the list of terrorist groups is done in coordination with our security organizations. This is a first for this country since 2019 that we've listed right-wing organizations as terrorist organizations. We have other names we've put on it recently, so we're going to continue to fight carefully against such violent extremism that we see that is growingly worrisome across the world and even in here in Canada. We are taking this very seriously as a government, and we're going to continue to do everything we can to fight back against hatred and violence.
Glenn McGregor, CTV News. Prime Minister, 1,000 more jobs lost at WestJet today, on top of all the other jobs that have been lost in the airline industry. You've been standing in the spot since the spring, saying that you're negotiating with the airlines to try and help them, and yet here we are in January, still no industry-specific package to help the airline industry. When is it coming, and what is the holdup?
We have invested close to $1.5 billion in support for airline companies in this country to support workers with the wage subsidy, with other measures, because we know that the airline industry is extremely hard hit by the COVID-19 pandemic. People shouldn't be traveling, and that, of course, is a direct challenge for the airline industries to manage through. At the same time, we've made it very clear that we expect people to be reimbursed. We expect regional routes to be protected. We expect certain things from the airline industry, and those discussions about how we're going to make sure that people are protected as we offer supports are continuing.
On vaccines, we're hearing that some countries have been paying a premium to get some of the approved vaccines, with the Pfizer vaccine in particular, Israel paying more than the United States. You've refused to say how much Canada is paying per dose, even though it is the government of Canada's money, and that's not very transparent, and I hope you will change your mind and give more information about those contracts. But I'm curious about whether or not Canada has considered paying a premium price to get more vaccine delivered faster, and if not, why not? Because it seems to be penny wise, pound foolish to not spend more on vaccines if we can get them into people's arms quicker.
From last spring onwards, we knew that securing sources of vaccines would be essential to get Canadians through this pandemic. That's why we worked very early with potential vaccine companies, and were among the first to secure contracts with many of them. We have ended up in the enviable position of having the largest array of access to the top vaccine companies around the world for Canadians, and indeed more doses per capita for Canadians than for just about any other country in the world. Of course, we need to make sure we're getting those doses as quickly as possible, and I can assure you that we continue ongoing conversations with the companies about accelerating the schedule of delivery so we can get Canadians vaccinated as quickly and as efficiently as possible. And the Minister of Procurement, Anita Anand, will be at the noon press conference and can answer further questions on this.
Hi, Prime Minister Tom Perry with CBC. You've been talking about getting all Canadians, or anyone who wants a vaccine, vaccinated by the fall. Are you still confident about that? And I just want to know, are you sort of basing that on vaccines that have yet to be approved?
We have secured a very strong array of different vaccines, potentially as they move forward. The Pfizer vaccine, the Moderna vaccine are approved. The Johnson & Johnson, the AstraZeneca are in the Health Canada rolling evaluation process right now. The experts who are in charge of our vaccine portfolio and indeed the schedule are confident that we are going to be able to vaccinate every Canadian who wants it by September. That will be significant in terms of getting through this pandemic and making sure that next winter looks very different from this one. But indeed, as vaccines roll out, we're hoping for 3 million Canadians to be vaccinated by the end of March. And into the spring, we hope to see many, many more millions of Canadians vaccinated as well. But we hold to September as the date in which every Canadian who wants one will be able to have gotten a vaccine.
En français?
Answer in French. We're committed to having all Canadians who wish to have a vaccine have one by September. It'll be important to be able to get to that point. We have many doses under contract with various companies, and experts who are managing our vaccine system are confident that we will get to our objective for September 2021.
And on the events this week in Washington, you've met with Donald Trump, you've spoken with him, you've negotiated with him. I'm wondering if you ever expected Donald Trump's presidency to end this way.
I think throughout the past 4 years, we have learned as a country and indeed as a world that the Trump administration was unpredictable and posed certain challenges, but at the same time, we've been able to work through in a responsible way, defending Canadian interests and moving forward in a way that always makes it very clear what our values are. We were able to renegotiate NAFTA in a way consistent with our values and our approaches and defend Canadian interests significantly in that area and in many other areas. Obviously, there is going to be much said and written about in the history books over the coming years about this time, but my focus has always been and will always be how to make sure Canadians are best represented, best defended, and best supported as we move through this world. And that's what we've done with this administration and what I'm very much looking forward to doing with President Biden as of a couple of weeks from now.
Answer in French. I think that Canadians have always expected our government to defend our values, our principles, and most importantly, our interests in terms of the U.S. government, which was hard to predict, and the U.S. government also presented challenges in terms of our relationship. But I'd like to remind you that we were able to negotiate NAFTA in order to defend our values and even create benefits and opportunities for Canadian workers and companies, even under a regime that was somewhat difficult. And we're going to continue to remain focused on Canadian interests in the years to come with the new President Biden when he will take office in a couple of weeks.
Canadian press, following on that, how concerned are you or were you that President Trump's exhortations on Wednesday would be heard by groups like the Proud Boys and others in Canada? And what concerns did you have about what President Trump was saying about creating potential threats to Canada's national security?
Well, we know that even as we watch with extreme concern everything unfolding in the United States over these past few days, that we are not immune to that in Canada, that we have a responsibility as Canadians to continue to lead with respect, to engage substantially with different points of view, and to never resort to violence as a way of impacting public discourse. That is something that Canadians have recommitted to across the country over these past days, and we will continue to be extremely vigilant to remember that the choices we make as leaders, as politicians, have consequences. What we choose to say, what we choose not to say, how we choose to say it, does have an impact on Canadians, encourages people to do some things, discourages them to do others. We need to be more responsible, all of us, in how we approach civil society and community engagement. And that's something that I think we are all rededicated to after seeing what can happen in the United States and elsewhere.
I think it's extremely important to remember that we all have a responsibility as Canadians, but also as leaders, to carefully choose our words, to make the right choices, to bring people together and to respect our various points of view, and to never leave room for hatred or extremism and violence. We have to learn from what happened in the U.S. and make sure that we are respecting each other. We have to work together, bearing in mind that we won't always agree on everything, but we always have to agree on the need to condemn hatred and extremist violence.
Earlier about other countries such as Israel perhaps paying more for vaccines and changing the economic dynamic of all of this. Do these actions undermine Canada's efforts to negotiate fair contracts to purchase these products? And are you considering changing the terms of those contracts or trying to pay more to do what you need to do because the landscape is changing?
I know that Minister Anand will have more to say because she's the one who is in direct contact with the vaccine companies as we work to bring more doses more quickly to Canada. But we have excellent relations with the various vaccine companies, and the way we are demonstrating our ability to deliver for Canadians across the country this really big vaccination program continues to be a proof point on the fact that we should be continuing to receive more and more doses quickly as we work with companies from around the world. Merci beaucoup tout le monde.
Thank you very much, everyone.
Minister of Canada speaking to Canadians, yes, about COVID and vaccination certainly, but also starting off his remarks with some comments about what has unfolded in the United States over the past couple of days, and making it very clear that he believed that assault on democracy, those were his words, was, quote, incited by the current president. I'll bring in my colleagues Catherine Cullen and Hannah Thibodeau as we wait for a public health briefing that will begin shortly. Hannah, I'll start with you. Obviously, strong language, certainly not the only world leader to use that kind of language, but the Prime Minister also making some important comments around democracy in this country.
Yeah, most absolutely. And these were some strong words that I think a lot of Canadians were looking for from the Prime Minister, saying that it was President Donald Trump that incited this violence of the mob that we saw take over Capitol Hill on Wednesday. One of the things, you know, he was talking about is by using these words, did he feel that it would wreck the relationship over the next couple of weeks? He said, and it was actually asked by our very own Tom Perry, and you could see the sigh in the Prime Minister before he answered that question. It's kind of like, oh, you know, he went on to say that the Trump presidency, after 4 years, you know, they realized that it was unpredictable and that it posed challenges. However, they did find a way to deal with this presidency. So yes, some very strong language coming from Prime Minister Justin Trudeau, but not the only G7 leader to use language like this. Right away, we heard similar language from the German Chancellor, Angela Merkel, also the British Prime Minister, Boris Johnson. So he's following in the footsteps of those leaders, but also, yes, a message for Canadian politicians too. And this is something he said he discussed with the premiers last night, that they may have differences, they may be of different political stripes, but they have to make sure that they're careful with these words. And also, one of those last questions as well, you know, asking if these words that Trump used on Wednesday to the crowd there in the United States, we also have, some right-wing groups in Canada. Did he fear that this might cause issues and incite them as well? And he went on to say that, you have to be careful. We're not immune to this here in Canada. You have to choose your words carefully. And people are sitting back after what happened on Wednesday and being more careful, in the words they choose to use.
Yeah, he didn't, as we expected, Catherine, bite, though, in terms of going much further down the road. It's one thing to say that the president incited the violence, as other leaders have done. It's another thing to say personal, critical things about this current sitting president. So he didn't go too much further, other than to talk about, how important democracy is, how the events were saddening and shocking.
So, yeah, I have to, say a little bit of a mea culpa there, that I didn't expect him to necessarily go very far. And the choice of the word incite, I thought, incited by the current president and other politicians, which I think is noteworthy as well, remarkable. But when it was time for him to reflect, we heard him lean once again, as Hannah said, on words like what an unpredictable relationship this has been, that there have been certain challenges. And I think we were all suddenly cast back to those days of the NAFTA negotiations. I think it is worth noting that he has been issued, in a manner of speaking, a certain political challenge by the NDP, saying these issues are germane here in Canada as well. Would you list the Proud Boys, for instance, as a terrorist organization? And he was asked about that today. I would say that while he expressed concern, the Prime Minister, I didn't hear any clear commitment on that front. He talked about how these decisions are made in coordination with security agencies and whatnot, but not any clear commitment on that front. Generally more broad rumination, the importance of working together. As Hannah said, he did say, talk about the importance of never leaving room for hatred or for violence in the words that politicians speak. The one other thing that struck me with this sort of harmonious tone generally, not only about the United States and how that reflects on the political relationships in Canada, but vaccines as well. We heard, again, that there's been this back and forth around the idea of Team Canada, a Team Canada approach to all of this. And I did actually, it was such a sort of warm tone about the relationship with the premiers and the need for certainty and working on a schedule beyond January so that everyone has the certainty they need, that I actually had to go back and check Twitter and see that it was indeed just yesterday that Pablo Rodriguez, the government House leader, tweeted, and this is a translation here, so you'll have to forgive me, but nearly 50,000 doses sitting in freezers in Quebec. Deliveries are accelerating. We need to pick up the pace, to which Quebec's health minister responded, the doses are not sitting there. They will be deployed and used. You could send us triple the amount. We'd use them quickly. So certainly it seems, from what we're hearing from politicians today, that they have settled on a more collaborative tone. There have been some chippy moments as well. And as was made incredibly clear today, this is a lengthy process. Many questions still remain about the timeline of the rollout. And the point has also been made. We're focusing on vaccines, understandably. There are a lot of other pressing issues when it comes to facing this pandemic.
Yeah, although it was also made, I thought the clearest so far that we've heard from the Prime Minister around the fact that he may not have that information to give the provinces right now. And we're probably going to hear more about that in this next briefing with the Minister Anand and Major General Fortin. But he said he will pass it along in terms of what they will get from the companies in February and March. And that, Hannah, speaks to, speaking of unpredictability, the lack of predictability and how much the federal government actually can do here.
Yeah, absolutely. And that was one of the things we're hearing from the premiers saying, well, we don't know how many doses we're getting. We don't know the delivery dates. And then the Prime Minister's office and the Prime Minister would say, well, we gave them that information for January. But what we're really talking about is moving into February. In January, we know it's going to be 1.3 million doses of the Pfizer-BioNTech as well as Moderna. As we head into February, I found it, refreshing from the Prime Minister to say that at this time, we're still waiting for the suppliers to give us those exact details. As soon as they have those exact details, they'll be passed along to the premiers, to the provinces, as to the amount of doses they're getting. So now it's becoming a little more clear about, the bun fight that we heard earlier in the week of premiers frustrated with the amount of doses they were hearing they were getting, and then the other side saying, well, you've got a bunch sitting in freezers. Well, really what's happening is that right now, now that first amount is sitting in freezers for some provinces because they want to ensure that the second dose is able to be there for those people who got the first doses. There are some provinces like Ontario that have just said, we're getting them out there now. We're getting them all out there. So some clarity from the Prime Minister when it comes to that schedule. And as you say, Rosie, we're going to hear more from the briefing a little bit later. One thing, I wanted to bring up as well was the fact about the job losses at Air Transat as well. That's something that I picked up. WestJet, excuse me. Yep, thank you, Rosie.
Sure.
The 1,000 jobs that were lost, and would there be any airline bailout? Because that's something that's been asked of the government for quite some time. There's still no answer to that, but you kind of got a hint from the Prime Minister as to why. He said at the end of his comments, he says, we want to know and expect people to have the reimbursement. So for those people who bought flights and haven't been reimbursed and they're still holding on to their credits. But not only that, he said, we not want regional routes protected. So you can hear the negotiations going on behind the scenes, a little bit in front of the scenes when he mentioned those couple of things as to why we might not see that bailout yet.
Yeah, they have canceled some regional routes and they haven't given that bailout yet. And those conversations have been going on for an awfully long time now. Catherine, you wanted in,
I just wanted to say that I think it's important to outline that there was actually a very specific and pointed criticism from WestJet of the government. I'll quote the CEO, Ed Sims. The entire travel industry and its customers are again on the receiving end of incoherent and inconsistent government policy. That a reference to the new testing that is going to be required of international travelers. And as you say, WestJet pulling its flights back by about a third, and 1,000 jobs that are affected by layoffs, furloughs, and whatnot. If I could pick up on another point, Rosemary, while we wait for public health, just turning back to vaccines for a moment, I thought another interesting question had to do with the price of vaccines. The Prime Minister was asked repeatedly to weigh in on that. I think we got a little bit of a sense of that in a briefing that came just before the holidays when Minister Anand was asked about whether or not Canada was paying extra to be getting these additional doses of Pfizer and Moderna. Once again, we didn't get a straight answer. That's the kind of information that the government has been withholding. But the suggestion, I thought, or certainly that I took away from the briefing that day, she said, we're paying fair market price. Well, as we have said repeatedly on these specials, this is an incredibly valuable commodity. These vaccines are some of the most valuable commodities in the world right now. So I think we would expect that whatever it is Canada is paying for these vaccines, it's a lot of money. And I don't hear any political voices anywhere on the spectrum in Canada saying that that's an issue.
Yeah, and there are other countries, although this country has not disclosed, there are other countries that have disclosed how much they're paying per dose, Israel being one of them, paying a high price to make sure that they get all of their vaccines for their population. I'm actually going to leave it there with both of you because the public health briefing will start shortly. Thank you both very much. Catherine Cullen, she's guest hosting Power and Politics today, and the CBC's Hannah Thibodeau will be with you throughout the afternoon here on CBC News Network, bringing you those updates. That is the Prime Minister's briefing for this Friday, giving us the update, obviously, on vaccines and the situation around COVID throughout this country, but also talking publicly for the first time since that takeover of the Capitol on Wednesday, saying that it was an assault on democracy, that it was shocking and saddening, but also saying that it had clearly been incited by the current president. I'm Rosemary Barton. We're going to take a short break. Our coverage will continue here on CBC News Network with Michael Serapio. Thanks for watching.